How do I know if I can become an organ donor after MAiD? All patients must be approved for MAiD prior to any discussions around eligibility for donation. Patients should discuss with their care team as well as MAiD provider if donation fits in with their end-of-life planning. Once approved for MAiD, testing requirements must be met. There are a few eligibility requirements for donation after MAiD. Eligibility for donation after MAiD includes being 80 years or younger, are not HIV positive, do not have a metastatic cancer, and are willing to have your provision in hospital. How do I determine which organs are eligible to donate after MAiD? First, we will determine if you are able to donate based on your medical history and condition. A BC transplant coordinator will meet with you to go through the process of organ donation after MAiD, as well as do a formal consent and go through required testing. Required testing includes blood tests, diagnostic testing like CT scans and chest x-ray, as well as a COVID-19 test. BC Transplant will work with your care team to coordinate testing, as well as make every attempt to minimize hospital visits prior to your provision date. Will I know what organs will be donated and who the recipients are? We will work with you and your care team as best as possible throughout the process of determining organ suitability. It is important that we protect donors, donor families, and transplant recipients' privacy. By law, we cannot share any transplant recipient information or identity, and vice versa. BC Transplant Family Services facilitates anonymous correspondence between donor families and transplant recipients if they are interested in connecting. Once you are approved for organ donation after MAiD, BC Transplant will work collaboratively with the critical care team to assist you and your care team with the process of donation. What will the day of my MAiD provision look like? Organ donation after medical assistance in dying follows the pathway of donation after circulatory death, also referred to as DCD. You will be admitted to the hospital 1 to 2 hours prior, and you can choose to have your family and friends present. You are able to make requests for a more personal and comfortable provision, including music, blankets, pillows, etc., to make the hospital space less clinical. Every effort will be made to ensure the setting aligns with your end-of-life wishes. Your provision will be carried out by your MAiD provider. Following confirmation of your passing, you will be quickly moved to the operating room, where your life-saving gifts will be carefully recovered. Can I change my mind about MAiD or organ donation? You can withdraw consent for organ donation at any time. Withdrawing consent for donation will not affect your ability to access medical assistance in dying. Organ donation consent is only obtained after approval for medical assistance in dying is completed. Following the medical assistance in dying procedure and determination of death, your family will be brought to a comfortable area and you will be immediately moved to the operating room. BC Transplant will have a surgical team in place to recover the organs to be transplanted. What happens to my body after donation? Following the surgical procedure, your body will be released to the funeral home, in accordance to your wishes for funeral arrangements. Does BC Transplant offer any support to my loved ones? BC Transplant can help guide and support family and caregivers. A BC Transplant coordinator will be on site to help support family, as well as family services can follow up with family to confirm outcomes of organ transplants, as well as provide grief and loss support.